So, where do we begin? Well, we're going to start by talking about how disorders are treated. And we have to start kind of with a historical point of view. And we've talked a little bit about this already, but here it is again. For a long time, people who had any sign of mental illness were basically just put into prison and ignored because these people are crazy. There's nothing we can do to help them. So, just go away. They were put into asylums that were overcrowded. Oftentimes they were put into prison. If they had committed any kind of crime, they'd end up in prison. Treatments were things like starvation, beatings, and isolation, all of which are not treatments and actually make mental illness even worse. So, yeah. By 1793, as you can see here, Philippe Pinel, a French physician, argued that treatments should be based on what actually works to reduce people who are crazy. And that's what they started to do. They began to implement laws to treat the people with mental illness as humanely as is humanly possible. They were observed as opposed to ignored. They were fed as opposed to starved. They were not harmed as opposed to being beaten. It's a real turning point. And it's really sad that I have to be excited and happy that that was what happened, because that's the bare minimum. I mean, these are people. Why are we treating them this badly? Well, because they were mentally ill and nobody cared about them. What's your point? So as we begin to study these people who are mentally ill, we start looking for new ways of being able to help them. And one of the things that's going to start popping up is what we call psychotherapy. Now, this is the overarching term for all psychological therapies that are out there. There are lots and lots of different types of psychotherapies. We will talk about many of them today, but it is a treatment for any kind of psychological disorder where a therapist helps a client, whether it be, one-on-one, in a large group, whatever. Therapists are generally psychology people, and they use psychotherapy to change the patterns of thought, behavior, emotion, any kind of psychological issues that you may be having. Okay. The reason why I say generally they are people who have studied psychology is because there are a lot of things out there that call themselves therapy, that are religion masquerading as therapy, or cults masquerading as therapy. There's lots and lots of really, really harmful things out there that will turn around and say, oh no, psychology is the real harm. Yeah. Not saying psychology is perfect, nor has it ever been, but it works. So let's just go with that. All right. So, we're going to go over most of these. So just moving on. All right. The beginning of psychotherapy, on a large scale, is going to be Freud, and that is his process of psychoanalysis. This is treating the unconscious mind, because again, that's where Freud believed all of the pains and issues came from, was through the unconscious, because if we don't want to think about it, we push it down into the unconscious, and there are conflicts that are going on all the time. And the more turmoil there is in the unconscious, the more turmoil there is in the conscious. So to be able to solve the problems of consciousness, you have to solve the problems of unconsciousness. Okay. As part of his treatment process, Freud would sit behind his desk. His clients would lie on a couch facing away from him and just talk it out and just keep talking. We call this free association. We've talked about that already. He also used things like dream analysis to get people to talk about things that they have been dreaming about. If they have a reoccurring dream, those were especially important to Uncle Freud. Okay. Freud worked to help his clients become aware of those unconscious thought patterns and conflicts that were causing them problems. Okay. So for a person who is studying psychoanalysis, they're trying to get at the unconscious. So if you're depressed, it's probably because you have a problem in your unconscious mind. And we need to use free association or dream therapy to get through to that issue in your unconscious, which probably has to do with your parents and how they were not everything that you needed them to be when you needed them to be it. It's basically what he would do. Another type of psychotherapy out there is humanistic therapy. This is for psychological disorders where a therapist works with a client to help them to develop into their full potential. We talked about this in our last unit, okay? Humanistic psychology is all about getting to be the best version of you, okay? No matter where you happen to be, getting to be that better version. Because, according to Carl Rogers, we have an ideal self and a real self, and the further they are apart from one another, the more anxiety and depression that's going to cause. So if you can bring the real self and the ideal self closer together, you will reach the heights of self-actualization. Okay, they did it generally through client-centered therapy, which is usually group therapy sessions, where you all work out your issues kind of together in the pursuit of greater self-understanding. Okay, so that's another approach. Next, we have behavioral and cognitive treatments. Behavioral therapies. If you've ever tried to stop a bad habit by taking a rubber band and snapping your wrist with it, that's a behavioral therapy technique. Hold on, I can't see the screen. Oh, I know what I can do. Hold up. Camera and my mic off. Join in the meeting. And I still don't know. Just turn that all the way down so that I can't hear myself. Wait. Okay. Huh? Big brain. I know, right? I still don't know what the last message was because I can't see previous messages from when I wasn't here. Hold on. Oh, that's a good one. Oh. Okay, so the question was, should you be writing this down? Hold on. There. The question was, should we be writing this down? Oh, so I can't turn that down anymore. All right, that's just going to bug me for the rest of the day. No, you don't have to write this down, but I would recommend that you take notes in some way, shape, or form. And again, I'm recording this, so you can take notes of this later. If you want to start now, you can kind of take the first couple of pages, but that's completely up to you. Anyway, behavioral therapy includes things with rewards and punishments. Okay, that's all about behavioral therapies. Like I said, if you've ever had a rubber band around your wrist and you snap yourself when you are thinking about something that you don't want to think about anymore, that's a form of behavioral therapy. You're trying to change your behavior by giving yourself a little punishment or giving yourself a little reward for doing something. Okay. It does work. It is something that is actually pretty effective at changing somebody's behavioral system. Those little punishments, even though they might seem really stupid, like, oh, this is going to hurt me or whatever, it actually does start to change the way you do things, because rewards and punishments, they work. Okay. Cognitive therapy aims to change the way that you think about a situation, whether it be through cognitive restructuring, where you completely rework and redo your way of thinking, or rational emotive therapy, where you basically have to stop your emotions from taking everything over, and you actually basically change the way you do things and the way that you think about things. Another very, very popular therapy today is cognitive behavioral therapy, or CBT. CBT is loved and despised by psychologists around the world. Loved because it gets results, and it gets them pretty quickly. Hated because it doesn't try to fix the underlying issue. It just tries to pave over the top of it so that you don't think about it in that way anymore. For example, you can see here in the example, we've got my boss yelled at me, therefore I'm worthless, therefore you fall into a depression. A cognitive behavioral therapy session will urge you to think about it in a different context. Why was he particularly angry? Was it something that you did? Well, no, he just came in yelling. Well, maybe he was having a bad day. Oh, yeah. Okay. And you just kind of glaze over the fact that you are not treating the fact that you think yourself worthless when somebody yells at you, even if you didn't do anything. You just kind of glaze right over that and go, he was having a bad day. It's okay. It restructures your thought process and your behavioral process to basically change everything that you are doing. And it works really, really well. Like, really well. Yeah. There was actually a podcast that I was listening to. God, it was a couple of years ago now. And this woman goes through cognitive behavioral therapy in the course of a week. And it's generally something that's supposed to take like 6 weeks to do, but she was reporting on it. And at the end of the week, she no longer, I think she was afraid of something, like something was causing her lots and lots of fear. I don't remember. I should listen to that episode again. Anyway, after a week of cognitive behavioral therapy, she no longer had the issue that she was having, and she could go on with the rest of her life as normal. And I heard it and thought it was great. And honestly, we need it here on this campus. Because a lot of y'all take things that your teachers are telling you super personally. And I'm not saying that you shouldn't, but I'm just saying, if you think about it in another context of, they're not mad at me, they're mad at themselves, it really changes the way that you respond to the particular situation. For example, young Jacob over here was talking about his trials and tribulations at his work. And if he were to take everything that a customer said extremely personally, he would most likely fall into a deep depression and want to quit his job because he hated it so much. But if you reevaluate the situation with cognitive behavioral therapy and just say, oh no, that person's just a terrible human being that has nothing to do with me. I did the very best that I could, and nothing I did was going to make them happy. It sucks to be them. And you move on with your life. It just releases all of the stress and the anxiety and the depression that you feel for what you're doing on a daily basis. Really, really great, at least in my opinion. All right. The context of the therapy is very, very important. Group therapy has the best cost efficiency. Multiple people share the therapist's time, and so you can get therapy for pretty cheap. group therapies vary wildly between the different types that there are. There are sex abuse groups. There are substance abuse groups. There are, marriage therapy groups. There's all kinds of different therapy groups that are out there for people. There's therapies for specific age groups. There's therapies for specific racial and ethnic groups. There's therapy out there for every group and every context. There really is not a really good excuse to not have therapy if that's something that you are in need of. Because if you're worried about the cost, these group therapy sessions can be very affordable. One of the things that has been advertised a lot on a lot of the podcasts that I listen to is something called BetterHelp. Yeah. BetterHelp is an online therapy session, basically, and it brings people that need therapy with people who provide therapy, and it's apparently pretty inexpensive. So, if that's something that you are interested in, you might be able to take a look at that. As for group therapy sessions on there, I haven't really spent a lot of time on BetterHelp because I've had a lot of other things going on in my life right now, so I didn't have the time to sit down and look at that. But it's out there. There's also family therapy. This is where the entire family goes to a therapist to get help dealing with some kind of familial issue that you are having. It's easy for a therapist to see family dynamics when the entire family is present. You don't get the one-sidedness of a therapy session where you are not in communication with the other members of the family. So it makes the therapy just a little bit easier to deal with, especially if there is some sort of systematic problem with the family system. It is, again, another very popular method of therapy that is out there. Cultural beliefs and societal beliefs have an effect on the effectiveness of the treatment themselves. For example, people who live in cultures who do not value therapy as a tool, and there are a lot out there, view therapy. Huh? Oh, I thought you were adding something. You were agreeing. Yeah. There's a lot of groups out there that just don't value therapy as a tool. You should just get over it and just move on with your life. But here's the thing. It helps. And why wouldn't you try something that actually helped? Unfortunately, in the history of psychology, a lot of psychology has been focused on middle-class white families. And because of that, members of, communities of color have not fully embraced psychology as a method through which you can get help that you need to get through, your day or whatever. If you are constantly being discouraged from going to therapy, it can make it so that it is less effective for you overall. However, you can overcome that, and you can just go, you know what, I'm still going to go and I'm still going to talk because I still think it's important for me to get this help that I need. So I'm glad to say that it's becoming less and less stigmatized in cultures, but there is still a long way to go in a lot of different cultures and societies in getting that help that they need. So biological therapies are out there. So beyond just the talking therapies that we've had so far, we can also prescribe medication. Psychotropic drugs affect the mental processes and can help treat psychological disorders. Psychotropic medications act by altering brain chemistry, either by adding neurotransmitters, inhibiting the release of neurotransmitters, exciting the release of neurotransmitters, or blocking the release of neurotransmitters altogether. Biomedical therapies have some pretty big, I don't want to say drawbacks, but they can have some pretty big side effects. Well, maybe you can go back at some point. Sorry. Anyway, they can have some pretty big side effects on an individual. Biomedical therapies can alter the brain completely by cutting parts of the brain out. They can also just change the way that your brain operates because of the flood of neurotransmitters that are either happening or not happening, depending on the medication that you're on. In extreme cases, we can perform what's called electroconvulsive therapy, or ECT. This is sometimes better known to people as shock therapy. Basically, you put something in the person's mouth so they don't shatter their teeth. And then you put electrodes to the temples, and you basically shock the brain into restarting itself. It basically just kind of shuts everything off for a half a second, and then everything kind of comes back on, and theoretically it comes back better. Why that happens, we're not sure. We just know that it does happen. In the 1950s and 60s, electroconvulsive therapy was extremely popular.
Windows startup.
Yeah, it just kind of, it's hitting that reset button so that you get back to the main screen. This was used in large, I don't want to say in large numbers, but this was used more popularly in the 60s and in the 50s. It has since kind of gone out of vogue, I guess I would say. But it is still used to treat people who are suffering from severe depression. That drugs don't help. Okay, medications, antidepressants, they don't help these people. Sometimes they use electroconvulsive therapy to do that. Electroconvulsive therapy can also be used to kind of knock the person out for a very brief amount of time. Basically, a person who gets electroconvulsive therapy, their entire body goes into convulsions. So they basically, your entire body seizes up, and it takes, I don't know, 4, 5, 6 minutes for you to kind of come back online. And so sometimes they will give you ECT when they need to knock you out temporarily for a brief surgery. I don't know if we'll end up talking about it, but we'll see. We'll see. And if not, I'll bring it up anyway, because it's kind of terrifying. We have transcranial magnetic stimulation. Yeah, this one basically changes the electric or the magnetic fields that your brain is experiencing, and can kind of interrupt the brain's processes, because remember, the brain is electrical in nature. I think it's on top of the head.
Okay.
Yeah, I don't think they cut your head open. But this is one that I don't know much about. This is kind of a new therapy to me. So, yeah, it says here that it's mainly used to treat severe depression. Does that mean that if you take a magnet and put it next to your head, you're going to be less depressed? No, that's not how that works. This is something else. Yeah, I don't know. That one's a new one to me. Moving on. You can also get deep brain stimulation. This helps to treat psychological disorders that involves passing electricity through electrodes in the brain to stimulate the brain at a certain frequency and intensity. This is often used to treat obsessive compulsive and major depressive disorders. Just kind of it's basically you have a pulse generator right next to your heart, kind of in your chest, and the electrode goes up to your brain, and the brain has these two electrodes that kind of stimulate the brain in that area to disrupt your thought processes, whether they be obsessive compulsive or having some kind of major depression. You can actually use this for something else. There was a video that if we were in the classroom, we would have watched, but we didn't watch it this year in class. This woman has what they call dystonia, and it basically is she doesn't have the ability to control her body completely. Like her voluntary functions are kind of messed up, and so she can look this way, and she can only look to her right. But she had one of these things implanted, and it basically disrupts the brain so that she can actually move her head so she can look to the left and look straight ahead, which is something that she would be unable to do. Like I said, there are side effects to that. She can't really talk that loudly. She's, limited in her speech, but she's able to, look around and be able to behave somewhat normally. Excuse me. So what do we have to indicate what are treatments that are actually safe and effective? Well, there are a lot of treatments out there that are believed to be effective, but don't have any kind of scientific support backing them up and can actually be quite counterproductive. For example, there's a therapy out there called rebirthing. Practitioners claim that rebirthing therapy can promote attachment and reduce traumas remaining from birth. But there is no scientific evidence that shows that there is any evidence or any trauma from birth, and that rebirthing has any kind of benefit to anybody ever. So when looking at therapies, making sure that we are looking at scientific evidence to back that kind of claim is really, really important. There are a couple of key features that characterize evidence-based psychological treatments. Treatments vary according to the particular psychological disorder. Okay, so it's not just a one-size-fits-all. Oh, you're depressed, rebirth. Oh, you have anxiety, rebirth. Oh, you have this, rebirth. The treatments change according to the specific symptoms that the client or patient is having. Techniques used in these treatments have been developed in a laboratory setting by psychologists, especially behavioral, cognitive, and social psychologists. And overall, the grand theory guides the treatment instead of adopting of specific treatments based on the evidence of its effectiveness. Okay, so you're looking at the individual and helping them, as opposed to, well, this treatment worked for these other people over here, so it'll probably work for you too. No, it probably won't. Okay. Nearly half of all Americans meet the DSM's criteria for a psychological disorder at some point in their lives. In any given year, 25% of the population meets these criteria. So there are a quarter of the population, 1 in 4 of you, are going to be experiencing symptoms of some kind of psychological disorder at some point in the near future, if not presently. And that's only the people who get diagnosed. Okay, there's a lot of people that go undiagnosed and they just kind of power through. And to those people, wow, you could have it so much easier. Just go to a therapist and talk to them for a little bit and they'll help you. You don't have to power through. You don't have to do all of that. Okay. Choosing the right treatment provider is extremely important for ensuring successful treatment. You don't want to be a person who is, going to a particularly religious therapist and you're not religious, because they won't be able to treat you effectively, because they'll be looking at you and saying, well, but God has a plan. And you're like, but there is no God. So what's the plan? So you have to find the right therapist out there. And if one doesn't work, it doesn't mean that all therapy is garbage. Try another therapist. There's a lot of them out there. I'm not used to having people respond, so it's a little weird. It's like, what? Huh? What's going on? Yeah? What? What? Yeah. So, medications are prescribed only by psychiatrists. They are people who have a medical degree. They go to med school. After they get a degree in psychology, they go on to med school, and they have to go through the whole process of med school, residency, and all that kind of stuff. But they get paid a lot, and there's a lot of demand for them. So, if you're interested in medicine anyway, why not? Psychiatry is a field that is always short on people. Okay. Efforts, however, are underway to give more practitioners, like clinical psychologists, the ability to prescribe medications. Again, it comes down to the fact that there just aren't very many psychiatrists, and people can wait months to see one. And in the meantime, they're, being not treated. So they need that extra help. The most important feature to look for in a provider is empathy and experience in the methods known to be effective in treating psychological disorders. You don't want somebody who's, judgmental a-hole. You want somebody who's going to be empathetic with you and be able to help you. If you're experiencing a therapist who is not being empathetic with you, who is, not treating you the way that you want to be treated, guess what? You can go to another therapist. Okay. You don't have to go to that one. Go to another one. Try again. Okay. There's a lot of therapists out there that want to help you. So you don't have to go to the one who's just going, yeah, but your parents are right. You're kind of a worthless piece of crap. Yeah. Don't go to that guy. Bad person. All right. The different types of psychologists out there. What I'll do is I'll take this individual slide and I'll post it to the classroom so you can get a kind of closer look at it. And because it talks about the degree that is required, as well as kind of the employment opportunities and kind of some of the training that people go through. So you've got clinical psychologists, psychiatrists, counseling psychologists, psychiatric social workers, psychiatric nurses, and paraprofessionals. There's a whole bunch of different things that you can take a look at when I post that. So don't worry about me going through this because I'm not going to. So what are effective treatments? Well, there's lots of different types of treatments that are good out there, and each disorder needs a different kind of treatment. Okay, so it's not a one size fits all. Again, it's not like, oh, you have anxiety? Let's try rebirthing you. Oh, don't you feel better? No, not really. Still got anxiety. Okay, so anxiety and obsessive compulsive disorders are best treated with cognitive behavioral therapies. If a person is experiencing anxiety because of thought processes that are going on inside their heads, cognitive behavioral therapy can actually work wonders at reducing that anxiety, if not eliminating it completely. The technique is very simple. It involves exposing a client repeatedly to an anxiety-producing stimulus or situation with the goal of reducing that client's fear. Now, I talked a couple of weeks, or last week or the week before, about the episode of, God, I wish I knew what that show was called. It wasn't Hoarders, but whatever it was. This guy who had obsessive compulsive surrounding El Caminos. Well, they were doing cognitive behavioral therapy with this guy. And basically, the therapist printed off a picture of an El Camino and told him to paste it on his wall. Okay? Paste it on the wall right next to the door so that every time you leave the house, you have to pass that El Camino. And then gradually they added more and more and more pictures until it was no longer an anxiety-producing thing to be staring at an El Camino. It eliminated itself and went away. Okay. Now, again, a lot of therapists would look at that and say, but you're not treating the underlying issue. Why are you afraid of El Caminos? But a cognitive behavioral therapist would say, who cares? Let's just make them not afraid of them anymore. Okay. Anti-anxiety medications can also be beneficial in some cases because they can have a sedative effect. They can kind of calm you down and make you feel a little bit better. The effects of cognitive behavioral therapy persist long after the treatment, which is, again, why it is so loved by many, many psychologists out there today, and can be a very good treatment for people with general anxiety, whether it be generalized anxiety disorder, obsessive compulsive, etc. Phobic disorders as well. Okay. Again, and speaking of phobias, you can learn through the process of cognitive behavioral therapy to reduce the anxiety that you experience when having that therapy or that confrontation with your phobia. Behavior techniques are the treatment of choice, along with approaches to changing a client's thoughts about the fearful stimulus. We typically call this systematic desensitization. This is a therapy technique that involves exposing the client to increasingly anxiety-producing stimuli. So, for example, the girl that was deathly afraid of spiders, it would start off with, "I want you to picture a spider far away from you. Just picture in your head a spider 3 miles from you." Okay. Does that give you any anxiety? No, no, it doesn't. Okay. Now we're going to move that spider a mile away from you. Now, how do you feel? I'm feeling okay. Now I want you to imagine that spider on the other side of the room. Does that give you anxiety? Yes, it's giving me a little anxiety. And you basically just kind of reduce their anxiety by kind of bringing them closer to it until they can actually hold a spider in their hand and not go into a full-blown panic attack. Another way that you can do this, which isn't a very good method, is what we call flooding, which would basically be lock the person into a room filled with spiders. Yeah, that's not a good therapy, but for some people it does actually work. So yeah. Here we have an example of this desensitization process. We have a little girl who's afraid of dogs. We have her, kind of cowering behind mom. Then she's encouraged to approach the dog. And then the owner of the dog is, kind of keeping the dog behind her so that, the dog doesn't leap up on her and scare her. And then eventually you can expose the the person to the dog and they are no longer afraid of it. Okay. That's a lot of the way that we get rid of phobias over the course of our lives is we have to go through the experience of having it. A lot of people are deathly afraid of speaking in public. And so, if you just have I want you to raise your hand and say something in class today. Okay. And then eventually you get to the point where you can, sit in front of a room of people and have them stare at you and not think about how awkward it is for you to be talking to people, not only in person, but also online. And did you get all the stuff out of your teeth today, or do you smell bad? Are you making sense? Do the people actually who are at home actually listening and paying attention? Because it would be bad if they weren't, but do you have to care? I mean, is that something that, anyway. Another way that you can conquer phobias is through virtual reality. This is becoming a larger and larger method through which you can help people with particular therapies. God, I don't remember the name of the game now, but there was a game where it's kind of, I don't know if it's designed to treat people with phobias or not, but it certainly seems like it would be an ideal tool for that because it's basically you put on the virtual reality helmet and you're in like an elevator and you have to push a floor and the elevator goes up, and then when the doors open there's things that are there to basically flood your experiences, whether it be suddenly this all these spiders start crawling onto the elevator, and then there's this giant disgusting spider that's coming at you and you're like, push the door, push the button, please close the door. But there was also one that I remember where it would take you to the very top floor of this very tall building, and then you were supposed to get out of the elevator onto a very, very narrow plank or ledge. And that was supposed to help people with a fear of heights. But I can tell you right now, it's a big fat nope from me. I'm going to pass on that one. Creepy. I'm fine with my fear of heights. I'm good. It's kept me alive for 40 years, so I think I'm going to keep it. Yeah, I'm going to keep it. Panic disorders. Panic disorders require cognitive restructuring because it is a way to reduce the reactions of the panic disorder. Because again, panics tend to happen as a reaction to stimuli. So if you can take a panic attack and kind of reduce it and reduce it and reduce it, it can make you more able to successfully get through a panic attack. Generally, knowing that you're in one is a big help, but being able to kind of work your way through it as it's happening because of the cognitive restructuring therapies that you've done, they're good. It works pretty well for panic disorders. I feel like I keep saying the same things over and over again. So here it is again. Obsessive compulsive exposure. Okay, we talked about this, so I'm not going to talk very much about it. Okay, reduce the fear, reduce the anxiety by going through by going through it, experiencing it. Okay. All right, we're just going to skip that because it's basically the exact same thing. So, depression and depressive disorders. What are the best ways of being able to do and treat that? Well, there are a lot of treatments for depression out there because depression is probably the most widely experienced psychological disorder that is out there. So we all have those kinds of feelings from time to time. Some people have famously come out as people who have experienced depression. John Hamm, for example, he is an actor. I hate him, but not because he's a bad actor. He is a fantastic actor. But I mean, look at him. Why would anybody be depressed with that face? And he's absolutely hilarious. Like, he is a great comedic actor. And he does, serious stuff fantastically as well. I hate him because I want to be him. Anyway, he has talked publicly about his experiences with chronic depression after the death of his father when he was 20. He credits psychotherapy and medication to help him overcome his depressive disorder. He said of using antidepressants, you can change your brain chemistry enough to think, I want to get up in the morning. I don't want to sleep until 4 p.m. I want to get up and go to work. And that helps to kind of kickstart everything, to get everything in motion so that you aren't spending your days, locked in a dark room, crying into a pillow. Okay. So a lot of people are against medication as a tool, and you certainly can overcome depression without the use of medications. However, they work. That's why they get prescribed, because they friggin' work. There are lots of different types of antidepressants out there. One of the most widely used are SSRIs, or selective serotonin reuptake inhibitors. They have the fewest amount of serious side effects, and they tend to be the first ones used. The best example of an SSRI is the drug Prozac. It is a medication that basically stops the reuptake of serotonin once it's released from your neurons. So your neurons release serotonin. Whatever doesn't get sucked up by the neighboring neuron gets resucked up by the original neuron. Well, in an SSRI, the medication basically stops the first neuron from sucking back up all the serotonin until the other neuron has a chance to absorb it all. Okay. And it typically has a pretty good track record of helping people. The use of antidepressants is based on the belief that depression is caused by an imbalance of neurotransmitters or a problem with neural receptors. Approximately 60 to 70% of clients who take antidepressants experience relief from their symptoms as compared to 30% who took placebos. Okay, so it is highly effective. The trick is to find the right amount because too much can cause other problems. And too little cannot take care of the issue itself and cause people to stop taking their meds, which can be quite bad. Again, cognitive behavioral therapy is another effective use for people who are experiencing depression. Cognitive behavioral approaches help the client to think more adaptively and eliminate the cognitive triad of negative thoughts. CBT can be effective on its own, but by combining it with an antidepressant, it can be more effective than either approach by itself. So, going through these cognitive behavioral therapies and using medication can really turn a person's life around and really help them to get out from the dark clouds that depression can kind of experience us through. Okay. We've talked about seasonal affective disorder and how bright lights can help you do that. That's called phototherapy. We're going to skip past that because we don't get sad down here. We just don't. You have to be up in like Canada to start suffering from sad. So yeah, it ain't happening around here. Bipolar disorder. These are especially useful. The best ways of treating bipolar is through psychotropic medications, things like mood stabilizers like lithium. Lithium is a naturally occurring salt that happens inside the inside the earth, and it can help you to kind of stabilize your mood so that you're not feeling highs or lows. You're just kind of right there in the middle. We don't know how that happens exactly, but we just know that it happens, and so they've been prescribing it for a very long time. Lithium itself has some kind of unpleasant side effects, like it makes you very thirsty, causes you to suffer from hand tremors, excessive urination, and memory issues. Lithium used to actually be in 7-Up. They put lithium in 7-Up. That was the up part in the 7-Up. They don't put that in there anymore, so drink it however you want. There are other types of drugs out there as well for treating bipolar. Yeah. All right. Moving on. Psychotropic drugs and medications can also help people suffering from schizophrenia. Antipsychotic drugs. I'm trying to remember. I think one of them is called Haldol. There's another one that I can't remember the name of it right now. Anyway, these antipsychotics help to reduce delusions and hallucinations, but it can affect a person's creativity. And that's something that a lot of people aren't really that keen on. And so people will kind of start not taking their meds anymore because they'd rather have the creative thoughts and the delusions than not have them. Okay. Just move past that. We're going to go on to this. And that we're going to move past too. Again, this is really the first time I've gone through this and how they've done this. So I'm kind of like, oh, what do I need to make sure that I cover? Behavioral therapy. Again, it's all about changing people's behavior into more appropriate behaviors. Behavioral interventions can focus on things like grooming and bathing, managing your medications, financial planning, things that schizophrenics don't succeed at most generally. We've talked about that already. That's a lot of umlauts. Jarskalarianen. He's probably Danish. All right. Personality disorders. Can they be treated? Yeah. So we can skip that. This is ADHD, autism. Oh, here we go. That didn't go very far, did it? Okay, so one of the most controversial parts of psychology today is treating children and adolescents. A lot of people are hesitant to treat an adolescent or a child, especially with psychotropic medication, because we don't have a lot of really good evidence as to what happens when a child is given a medication for a prolonged period of time. We don't know if it's going to be okay or if it's going to be really bad. We're hoping that it's going to be okay. And so about 12 to 20% of children may be experiencing psychological disorders, or at least enough of the symptoms to be diagnosed as such. Depression in adolescence is very, 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 very high. I'm sure you've experienced that. Yeah. Being an adolescent is difficult, and adults tend to forget that because they're like, I made it, so what's these kids' problem? God, they're so whiny. Ugh. Being an adolescent is difficult. Yeah, the side effects can be really, really nasty if you get changed from one to another. You might want to, talk to your therapist about going back to the old one if that's at all possible. Anyway, there are risks for giving children medications. The reason why you're not eligible to get the vaccine is because they haven't studied what the effects of a vaccine on a child is. And so until they do that, you're not going to get the vaccine. But they're working on it. They're working on it right now. So, maybe by summer. Yeah. Giving kids medication is very, very difficult to be able to talk about. And so most times children get therapy. They get some kind of talking therapy, whether it be cognitive therapy or cognitive behavioral therapy or something along those lines. Moving swiftly through because we're running out of time. Autism, that's something we haven't talked about. So let's talk a little bit about autism. Autism is a spectrum disorder that has varying degrees of impaired communication, restricted interests, and deficits in social interaction. There are people who are high-performing autistic people. There are people who are low-performing autistic people. It is a spectrum, so there is a wide variety of different people out there. Changing these behaviors can be very, very difficult because reinforcers are very hard to find. So behavioral therapies don't tend to work very well. The tendency for people working with autistic patients is to focus on specific details while ignoring others so that you can get some kind of therapy into them. Autism spectrum tends to benefit most from structured behavioral therapy. This is where an applied behavioral analysis takes place, that we look at one thing and then we try to fix that one thing. Okay. It's an intensive approach which requires a minimum of 40 hours of treatment a week. So that's a full-time job. So it is expensive and time-consuming. Yeah. 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 A biological approach to autism. There is some evidence that there is a neurobiological thing that if we could discover it and find it specifically, we could use it to not only understand the autistic person, but treat them. We've already talked a little bit about that. ADHD. Patients with ADHD can benefit from various approaches. Attention deficit hyperactivity disorder is a psychological disorder that should be treated. But some people believe that it's just a pattern of behavior that kids will eventually outgrow. I remember something a couple of days ago, not a couple of days, a couple of years ago, I think it was an episode of South Park. A psychologist comes to town and basically diagnoses everybody as ADHD. And then another psychologist comes in and gives the sit down and shut up therapy, which is you scream at the child to sit down and shut up until they sit down and shut up, which is the treatment that we used in the 1950s and 60s, and didn't really work all that well. But that's what people today, the boomers, as it were, that's, well, it worked for me. Did it? The most common treatment for ADHD is a nervous system stimulant, which is a drug like Ritalin or Adderall. These are not specifically understood, but what we do see is that it does help to kind of bring focus for people who suffer from ADHD, to be able to actually sit down and shut up, to be able to get their work done so they're not just kind of all over the place. Squirrel. That is a major thing with these stimulants, and that's why you would give a stimulant to a person who has attention deficit hyperactivity disorder. But they're already hyper. Why would you make them even more hyper? Because it makes them hyper focused on what you want them to hyper focus on. Oh, that makes sense. Here you can see some of the effects of Ritalin on various people with ADHD. Ritalin only slightly increases behavior or positive behaviors, but it has a large effect on decreasing negative behaviors. So it has a little bit of a good on positive, but it has a massive one on reducing the negatives. Okay. Negative verbal remarks, interruptions, conduct problems, non-compliance. All of those things go down, and the positive stuff goes up a little bit. And that could be, honestly, that can be enough to really help people. I'm sorry, I didn't mean to laugh. That's mean on a whole level. I mean, yeah, that's really messed up. Wow. Kids are terrible people, because they also know exactly where to jam that knife. Anyway, behavioral therapy for people with ADHD can be kind of hit or miss. Operant conditioning can punish people for problem behaviors, but it's not really their fault. So you're punishing them for things that they have almost no control over. But it can have an effect. So people do use it. Yeah. So there's that as well. All right. Yeah, it seems like it. Don't you wish you could go back to second grade? I mean, I know I do. You couldn't pay me. You could not pay me enough money to go through middle school ever again. Middle school is the worst. And it's the worst for everybody except like 2 people. Hate those people. Anyway, so that's kind of the rough run through of different therapies. Like I said, we have a lot of different therapies that we use. Cognitive therapies, which change the way you think about a problem. Behavioral therapies, where you use rewards and punishment to change your behaviors. Cognitive behavioral therapies that are used to change the way people think about things. Then you have medications, you have biological processes where you can cut out a piece of the brain. One therapy they didn't talk about, which we don't really use anymore, is called the transorbital lobotomy. And a lobotomy is where you remove a lobe of the brain. And in the transorbital lobotomy, they take an ice pick, which is a very, 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 very sharp stick, and they lift up your eyelid and they put the stick between your eyeball and your eyelid. And then they take a hammer and they knock it into the brain and they kind of wiggle it around, destroying your frontal lobe. And then they very, very carefully take the ice pick out and you're cured. At least that's what they thought in the 1940s when they created this therapy. It doesn't really work all that well. Some people, it does actually help. Some people, it makes them worse. And some people are turned into vegetables. Yeah, it's not a very sensitive term to use, vegetable, but that's basically what they get turned into. So, yeah. All right. So let's go over to here. Yeah, I haven't seen Ratchet yet. I kind of mean to, I kind of don't mean to. I know it's a show my wife isn't going to want to watch, so I'm not going to, it's not something I have to wait for her